All right, how is everybody doing? It's, what is it today? January 3rd, I think. We are going to talk about cholesterol medication, okay? So mostly what I want to find out from you, and I want you guys to comment, what do you think? I know your doctors want you to have low cholesterol. What do you think? Should you have low cholesterol? Comment below. Let me know what you think. Let me know. Do you think you should have low cholesterol or not? All right, now, if you had low cholesterol, how would you know if you had low cholesterol? Because what doctor's ever going to tell you, hey, you've got low cholesterol? They might tell you that your cholesterol looks good, but they're probably not going to tell you that it's low because nobody ever talks about low cholesterol. So first thing we got to find out, is low cholesterol good for you or not? Is high cholesterol bad for you? So I'm going to talk about this for a minute because this really bugs me, all right? This really bothers me. Nobody ever talks about low cholesterol. Everybody talks about high cholesterol being a problem. I'm going to tell you this. High cholesterol, elevated, it's high, okay, it is not a problem. High cholesterol is not a problem unless you have inflammation. Cholesterol plus inflammation, okay, is going to make the cholesterol stick to whatever's inflamed. So if you have inflammation in your artery walls, you're going to cholesterol stick to it. It's going to create blockages, okay? But cholesterol by itself, even with a blockage, doesn't create a problem for the vessels unless the vessels are also hardening, because they'll just expand and let blood around it. So cholesterol, not one study ever, I don't care who you are, I don't care if you can prove to me a study, if you can show me a study that says cholesterol for sure causes heart disease, I'll eat my words, okay? Not one study's ever proven that cholesterol causes heart disease. They only show that cholesterol's there when there's heart disease. The inflammation causes the cholesterol to stick to your arteries. The cholesterol is not bad for you, okay? Cholesterol is not bad. Low cholesterol, is that a problem? Is anybody commenting yet, Karen? Anybody comment? All right, some thumbs up. Low cholesterol, is it bad for you? The reason this is important, okay, low cholesterol, low, is a bigger problem than high cholesterol. Crazy, right? Low cholesterol is a bigger problem. Why is that? You need cholesterol. You have to have cholesterol. You have to have it. It's a must. Okay, now I'm going to show you this here. This is, you're going to have to tell me if I'm close enough. All right, this is a hormone cascade. What happens is, this is how many of your sex hormones, your steroid hormones, are made. They start out right there. I don't know if you can see that on there, but they start out as cholesterol. So your cholesterol is needed to make all of your stress hormones, like your cortisol and cortisone. It is required. You can't make it without it. It's the precursor. There's nothing else on the sheet before that. It has to have cholesterol to make your adrenal hormones, and all of your sex hormones, your progesterone, your testosterone, your estrogens, all are required, can't make it without cholesterol. So you have to have cholesterol if you want to make your steroid hormones. So guess what? All you women out there, all you men out there who are having sex hormone problems, maybe you're having low T, or you have estrogen issues, you have progesterone problems, and you're wondering why you can't get your hormones normalized. I bet you'll never get your hormones normalized if you're on statin medications. So if you're on cholesterol-lowering medications, or your cholesterol's low because you think that you're healthy because you have low cholesterol, guess what? You're going to have hormone problems because you can't make hormones without cholesterol. All right, so we're going to talk more about statins in a second. This is a picture of a nerve, okay? Now I'm just using this as an example because there's different way nerves are made, but this is just, you know, a general nerve. This is the cell body, going back to like your 6th grade anatomy here. Cell body and the long axon. Well, so this little line that I have going through the middle is the little nerve fiber, and that little nerve fiber has to be protected, all right? And it has a covering around it which helps speed up the signal transfer along that nerve. And that covering is called myelin, okay? And that myelin is, guess what it's made out of? All right, just guess. All right, that's right, cholesterol. You have to have cholesterol for a healthy functioning brain and healthy functioning nerves. You have to have it. All of your cell membranes have cholesterol. But the two biggest things you need cholesterol for is for your nervous system, so your brain and your hormones. And without cholesterol, guess what you're going to have? You're going to have neurological disorders and you're going to have hormone problems. So what would be considered low cholesterol? Anything under 160, right? Personally, I would be thrilled if my cholesterol were over 200, okay? I don't have a body type. I would have to eat way more than I'm comfortable eating. I just don't get that hungry that often. But anything under 160 is a problem. You're going to have problems, neurological issues. You're going to have hormone issues. My mother-in-law, she was having trigeminal neuralgia. She was having pain in her face due to her nerve. And the cholesterol, the covering around the nerve, was being worn away by the way her bone was aligned in her neck. And that didn't start to show up until her doctor put her on a statin medication. All right. So guess what went away? Like this debilitating facial pain went away when she stopped taking the statin medication. The cholesterol lowering medication, all this debilitating facial pain. She could barely brush her teeth, couldn't brush her hair because it would cause electrical shock-like pains in her face because she was taking a cholesterol lowering medication. All right. So what's better, to want to shoot yourself in the head because of this facial pain or have high cholesterol? The truth of the matter is she needed to be not inflamed, so she needed to get her diet in order so she reduced inflammation and then not worry about the cholesterol. It didn't matter whether the cholesterol was high. What mattered is that she was having problems with that myelin, having pain, and potentially having hormone problems. Now, so cholesterol lowering medications. Y'all are going to the doctor and they're saying, we need to put you on a statin drug. Okay, statin drug is a cholesterol lowering type of medication. Okay, so according to Journal of Neurology, May 2002, I believe it was, they said there's a 16 times greater risk, 1,600 times greater risk of developing neuropathy if you're taking statin medication. So those of you who have neuropathy, guess what? If you're taking a statin medication, it's the number one cause of neuropathy. All right, why? Because you reduce the myelin around the nerve starts to die, okay? Now, cholesterol lowering medication causes pain, it causes lower energy, causes muscle fatigue, muscle weakness. When a lot of times one of the common side effects of statin medications is low back pain and leg pain. So why is that? It's because the muscles require so much energy. And statin medications, while they lower cholesterol, one of the other things they do is they reduce an enzyme, all right, called CoQ10. This is an enzyme. And this enzyme is 100% required. Like, you can't get away without it. This enzyme is required for you to produce energy in your little mitochondria, your little powerhouses of your cells. Your little mitochondria produce something called ATP. And I won't bore you with what that is. You can look that up. But this is your energy. Like in the United States, we use money, we use dollars, like United States dollars to buy things. You can't walk into a drugstore in the United States and use a ruble, a Russian ruble, or a peso from Mexico to buy stuff here in Tennessee, because that's not the energy we use to buy things here. We use dollars. Well, the energy your body uses is ATP. And CoQ10 is required in your cells and your mitochondria to produce ATP, all right? Guess what statin medications do? They reduce CoQ10, all right? They reduce this so we don't get energy. So how fast is our body's going to repair? We're not going to repair very well if we don't have this ATP. We're not going to have much energy. Our muscles are going to get fatigued easy. Our nervous system is going to get fatigued easy. Our brain function is going to go down. Our brain needs so much energy. It's the most energy dependent part of our body. So cholesterol lowering medication. Raise your right hand. I'm not telling you to stop taking your medication. That's not what I'm here to do. I'm just telling you that this medication, cholesterol lowering medication, statin drugs, can cause big problems for hormones, nerves, and energy and repair in your body. All right. I'm also telling you, this is true because you could do the research yourself, high cholesterol does not cause heart disease. Inflammation combined with cholesterol causes heart disease. So if you came to our clinic for something and said, well, I'm inflamed, and you had high cholesterol, we'd say that's a problem. But we wouldn't be trying to lower your cholesterol. We'd be trying to lower the inflammation because cholesterol is needed in the body. All right. So more problems have come from statin medications than can be written in volumes of medical textbooks. So low cholesterol is a huge problem. We don't want low cholesterol. I had a patient in our office today. I wanted to do this video because frankly I get sick of all the information and the commercials and stuff about statin medications and people coming out saying, oh, this is healthy for you. I just don't personally believe that it is. But I had a patient come in earlier today. She had a cholesterol of 97, all right? 97 on her blood work was her cholesterol. So I thought, we really need to say something about this because we have patients coming in all the time and they're on a functional medicine program to fix their hormones. And they got these hormone issues. And their cholesterol, their doctor is really happy because their cholesterol is like 143. And I'm like, you can't have a cholesterol of 143 and have normal functioning hormones. It's not going to happen, right? So 143, I'm like, your doctor's crazy. All right. So, we go, look, eat a bunch of healthy fatty foods, get that cholesterol level up, get it up. Really, over 200 is not a problem. You just don't want inflammation. So you have to eat healthy. You can't get rid of inflammation by eating the standard American crappy diet. Okay. You got to eat a healthy diet. Look for good healthy fats. All right, you need healthy fats. They're so important for your brain, as we talked about, so important for your hormones, so important for your cell membranes. You've got to have these healthy fats. If you are not going to stop taking your statin medication, if you go, no, I'm not going to stop taking it, okay, but if you're not going to stop taking it, you better go to the drugstore or health food store and get some CoQ10, all right? You better go get some CoQ10 because you need that enzyme. So supplement your diet with CoQ10 if you're taking a statin drug, all right? Go get some. I don't advise going to Walgreens or CVS or Costco or stuff like that because they don't have really high quality. But get a high quality CoQ10 because you need that enzyme to produce that energy molecule in your body. So if you're going to take your statin medication, well, you're going to have a problem with low cholesterol. You're going to end up problem with the hormones and the nerves, okay, potentially neuropathy and that myelin. But if you take CoQ10, you could probably mitigate and help out the ATP problem. All right, so let me know if you find this helpful. Let me know what put it in there if you want. You can, I'm not telling you to violate your own personal HIPAA, but post your cholesterol number. Some of you should be proud. You should be like, man, our 220. We'll be like, right on. We do not want low cholesterol. All right, so let me know if you found this helpful. If you have family members who are on statin medications, I would advise you share this with them. Why don't we create some controversy? Get people pissed off at this one like they were mad at my neuropathy and gabapentin video, because I'm not here to tell you to stop taking your statin medications. You understand that? But people should understand this. If you know people that are taking statin medications or have low cholesterol and they're having health issues, they should understand this. And the thing that I always ask of you is please share the video. All right, hit that share button. You can give me some little hearts, some little thumbs up, but please hit the share button so that more people can understand their health and take charge of it. You're the only one who's in charge of your health. It's not a doctor's job to take care of you. Your job to take care of you. So we appreciate you watching. We're looking forward to doing more videos this new year. Again, hit that share button, like, follow us. Appreciate you watching. Have a great night.